Yes, thanks for staying with us. So women have always been the focus of birth control. But in recent times, male contraceptives, also known as male birth control, are now coming to the fore. As research has shown, the majority of men are seeking male contraceptives, but many are concerned about the side effects of hormonal injections. Joining us on the show is the Professor of Obstetrics and Gynecology, Lagos State University College of Medicine, and the Chairman Governing Board of Institute of Fertility Medicine, LASUD, Professor Adetokunbo Fabanwo. Welcome to the show, sir.
Welcome, sir. Great to have you again, sir.
So you can give us a view 070-806-68014. You can also tweet to us at TVC Connect. Please hashtag UWTVC so we can read your tweets. Before we go into male contraceptive, very quickly, what's your view on African disciplinary action? Do you believe it's abuse, or do you agree that it's actual disciplinary action?
Well, I think the way that our parents had shown discipline had been counterproductive. I do not believe in capital punishment like caning and so on and so forth. I believe that as soon as a child is able to understand issues, then you should explain why what they are doing is wrong. But if they persist, spank there.
Okay. All right, good to know. All right, so going to male contraceptives, people have been talking about it. I mean, recently, your view treated the topic just a couple of weeks ago.
Quickly on that.
Yes.
There was a man who said to his wife that he only wanted 3 children, but they had 3 girls, and she was looking for a boy, and they went ahead to have 5 children. At the 5th one, he said to the gynecologist to take out the child alongside the womb. And we were like, sir, why didn't you do vasectomy, which is easier? So the discussion on vasectomy then arose. A lot of men are concerned, thinking is irreversible. Would like you to explain a lot more about vasectomy and male contraception generally.
Okay, thank you. Let me just clarify a few things before we go on. I'd like to clarify the differences between contraception, sterilization, and family planning. Family planning is a concept. Okay, you want to space how you have children, and then you want to limit the number of children.
Okay.
How you do it may be by contraception.
Okay.
And there are many contraceptive methods, usually temporary. Okay, if you want to have a child, you can decide to have a child. But sterilization is permanent. So vasectomy is a form of sterilization. It's permanent. Once you do it, that's it. But sometimes you can wish to reverse it. But reversal success rates vary. Yeah, that's it. So vasectomy in our culture is not well-grounded.
Why is it well-grounded?
Permanent.
Why is it not?
No, when you say well-grounded, what do you mean by well-grounded?
Men are not doing it.
Okay.
We set up a vasectomy facility some years back. As a matter of fact, some of us were sent abroad to Philippines to just learn the science of office vasectomy, because really it's an office procedure, And then we came back, we set up a unit in IKEJA, and in 5 years we had 2 clients.
Jesus.
Wow.
Yes. So African men do not want to have vasectomy.
Okay. So I thought vasectomy was just a situation whereby you just can't have kids. Not that you can't, your organ can't be functional, because people confuse that. But does it mean that I become
virility and sterility? I mean, does it?
Now, vasectomy simply means that there's like a tube in the scrotum, which is the vas deferens, through which the sperm cells pass. So all you do is just to tie that tube, and so that sperm cells do not pass. All right, but your other male functions remain. You get an erection, you can have sexual intercourse, but a lot of men feel that once you have vasectomy, you're going to be castrated. You can't be potent again.
Right.
Okay. So this thing is not really, I think, an African thing. I was reading about it. I hear worldwide, most men do not think that option of vasectomy is what they would like to take. But could you just maybe use this opportunity to educate the men and say, like you've already said, maybe just further, that this would not stop you from being a man? Because I think men look at their ability to be able to
May I buttress this point?
Yes, as being a man.
May I buttress the point that they
believe-
even say that after vasectomy, sex is even more enjoyable for men. Now, I cannot impregnate any lady, and you are still as erect as before. Is that true, sir?
First, let me correct you.
Okay.
It's an African thing, and I have statistics, okay? In Canada, the uptake of vasectomy was 22% over a 10-year period. In New Zealand, it was 21%. In the UK, it was 20%. In African countries, it's less than 1. 0.7%, 0.4%. Most African countries that were studied. So it's an African thing. Okay, the Caucasian tends to understand the issues more than there's something in us as Africans that will make us not really understand the issues. Now, back to this issue. Yes, there's no loss of potency in the sense of erection. But you lose your potency in the sense of getting a woman pregnant.
Yes.
So men need to understand that.
Okay.
But I think the issue is mainly cultural. Men feel that the responsibility of limiting family size should be a woman's responsibility.
Exactly.
They don't see why they should be burdened with the issue.
I've gotten to where I'm going.
Yeah,
and we
they
women,
don't see that.
on behalf of us all, we are tired. We've been overburdened with the responsibility of. Recently, a very close friend came to my house and said, I don't know how, but I think I'm pregnant. So I gave her a PT test to do. And then she came back and said, it's positive. What am I going to do? She was crying. I was like, you should be talking about this with your husband. It's two people that do the do. Do you understand? But she was feeling so burdened. We are tired.
Honestly, I think it's time.
What are the options of contrast of family planning open to men? What are the other options open to men? And why are they not being explored aside vasectomy?
Apart from vasectomy, I'm sorry to say that it's really bad news about male contraceptives.
No wonder.
A lot of research is going on. A lot of animal studies have been done. But the nearest we have come to another form of contraceptive is what the University of Washington Medical Center has come up with recently. They've now found an injection, okay, which shows promise. Okay, it's an injection that you can administer, and men over time would no longer produce sperm cells.
Okay.
Also, there are pills that can be used. All right, this research has been hampered by the fact that men insisted that they wanted something that they would just take once a day, just like the female pill. So, but recently, the University of Washington has been able to come up with a pill that you can take once a day.
Okay.
And then they've shown that it can be effective in limiting sperm production. You see, the thing about developing drugs is that it has to go through a lot of stages.
Yeah.
You have to do animal studies first to check about the safety and so on before you can try it on human beings.
Why has it taken them so long, though? I mean, we have gone so far with female contraception. You would think that we would have had back years of study on the male. Is it just the patriarchy thing? You know, you just put everything on the woman. You ask her to take pills. You ask her to take out her womb. You ask her to cut off her tubes.
No.
And still, there's not one thing that the man can do.
No, you see, the male physiology is a bit different from female physiology. As I explained earlier, you know, when you administer hormones to a man, they tend to get cleared away from the system rapidly. And that's what has limited successful research into male contraception. So what the University of Washington has been able to find out is that if they add a sort of fatty acid to the hormone, it will delay the clearance of the hormone from the blood of the man. So that's why they are now near to success in that research. You know, so it's not that they've ignored, the research has always been ongoing. A lot of pills have been developed, but side effects has been the major issue. Side effects, and even this one that they've started.
Let's go on a quick break. When we come back, we'll talk about side effects of vasectomy and since you're an OBGYN and you've spoken to people and you've probably experienced families go through this issue, I'd like you to share a few experiences with them so that how families can manage this situation of birth control, especially in male. Stay with us, we'll be right back.
Stay tuned. Your View will be right back. Welcome back to Your View.
Thanks for staying with us. So for those who probably live abroad, who understand or who might even have access to these pills, you know, I know the pills are not probably available in this
They're not
part of the world
yet. No,
right.
not yet.
But are there any side effects? And even with the vasectomy, are there any side effects at all for men?
Well, let's talk about vasectomy. Okay. Now, vasectomy, there are very few minor side effects after the procedure. Like I said, it's an office procedure. It takes just about 20 minutes. So you can have pain at the site, because what you really do when you do a vasectomy is to make a little incision on the scrotum, bring out that cord, cut it, and then tie it up. As simple as that. So you can have a little bleeding, a little pain, you know, and in some cases, they've had what they call post-vasectomy pain syndrome, in which that pain will persist for long. But it's never more than that, okay? There's also a side effect of regret. Some men regret that they had done it.
Why? Because they want to have more children?
Yes, because
Later.
they didn't think it through before they did it, or because they fell out with the wife they had. And
Let me take this call, sir.
Okay.
Good morning. Are you there from IKEJA? Go ahead, please. KANU, go ahead, please.
Hello?
Hello, go ahead. You're live. Go ahead.
Hello, good morning.
Morning.
Hello, good morning.
We can hear you. Go ahead, please.
I just want to contribute concerning treating the children.
Okay, very quickly, please.
I just want to say something about African, the way we should take care of. Hello?
We can't hear.
We can hear you. Go on.
Listen to his TV.
No, you can't listen to your TV. It won't work.
Okay. All right. So,
I was going to focus on this discussion of men believing that it is the woman's duty. Oh, of course, there are many more contraceptive methods available to women. But there was a case of this man who said because his wife had breached their contract to have 5 children, he had the gynecologist remove her womb at the 5th cesarean session. Is that legal? Should it be allowed? And in such a case, as a gynecologist yourself, what would you recommend?
I don't know the details of the case.
Okay.
But if you said the woman was having a 5th cesarean section, there was absolutely no need to remove the womb. All we do is to tie the woman's tubes so that she won't be able to get pregnant again. I wonder, you know, I think the man must have been informed and he must have stampeded the doctor. Because a doctor should have explained to him that there's absolutely no need to remove the womb. That once you tie the fallopian tubes, the wife will not be able to get pregnant again.
let me take this call from Ike. Ike, are you there?
Yeah, hello,
Thanks for
how are
calling.
you?
Go ahead, please.
Yes, I want to contribute to what you are saying.
Go ahead.
The issue of vasectomy, the man there and any other woman there should know the importance of releasing of sperm inside a woman by a man during intercourse. That's the most weakest part of it. And when you stop it, the value of that will not be noticed by the man. That's the main reason men doesn't want to involve in it.
Thank you.
Let me take it with the tweet.
Let the doctor correct
Say,
me.
how
No, I
does a
didn't
man
hear
get
him.
orgasm if the sperm cells are tired? Because I think it's when they are not tied that the man can be satisfied.
So they are mistaking sperm with semen. Please explain.
I didn't get it.
So he was saying that you should know the importance of a man releasing sperm into a woman during intercourse. So that's why he's against vasectomy.
No,
but they do not know that
but-
sperm is the one that fertilizes the egg.
But let me.
That's what is called semen. That is the total fluid that comes out. It's only the cells that are going to be stopped from joining the fluid. The fluid still comes out, so you still have an orgasm.
Right.
You still enjoy sex,
Right.
but the cells don't join it, and so there's
Now,
no
going to
pregnancy.
the issue of semen, is there an option in Nigeria for men to freeze their sperm. So just in case they do have a vasectomy,
Thank
they can
you.
keep that somewhere.
Excellent.
And in future, they can then have.
Excellent question. In fact, the big thing now abroad is what we call cryopreservation before vasectomy.
Okay.
So that in case you decide thereafter to have children, then you can just go pick up your sperm cell and do an IVF or IUI, intrauterine insemination.
No, that sounds...
And then-
What's the cost implication?
No,
Someone
that-
is asking.
Yeah, I was
There are
just
three
going to go
questions.
there. I
Let me
mean,
quickly
that's...
take just 3 questions. Babawale says, please, what can we do to cure premature ejaculation because it's affecting me? Premium Home says, morning, please can the amiable professor give us the cost implication for birth control?
Exactly.
And the last one, Ade says, please, can you ask the guest, after vasectomy, can a man still attain climax? You already answered that one.
Yeah.
Okay, so
Cost implication.
No, well, we should leave premature ejaculation.
Yes, I agree.
I want to leave that. That's a different issue. Cost implication, most family planning clinics, they come at very cheap rates. The cost implication of a vasectomy cannot be more than 2,000 naira.
Imagine.
Yes.
What?
Yes, vasectomy.
Maybe it's a 20
Public
minutes.
hospital or private?
It's a
doesn't
20-minute
matter.
procedure.
Even private, what 5,000 naira.
Okay. What chances are there? Because of, no, because you brought it into question now. Because it's so cheap. Some doctors might think it's a simple procedure and more mistakes might happen. Because you mentioned the side effects of pain post the procedure.
but it's just a few days
These are
pain.
minor
Cut the
things.
scoot off.
pull out the
Which
cord,
is-
tie it,
I mean,
chicken.
I mean, can we even compare it
It's
to what the
nurses
woman
that
has to
do
go through?
vasectomies.
Nurses!
Yeah. Trained nurses that carry out vasectomies.
And a woman's womb was removed.
on this
And
matter.
I know what is
the
very
2,000
exciting
naira
about
matter.
this. You can actually be awake while this is going on.
Oh,
so you
you're
are chatting
awake.
on your phone and you're talking
awake.
and
It's
this is
local
happening.
anesthesia.
We have suffered.
It's local
But
anesthesia.
instead, you rather
African
put this
women, we
woman
have
on a
So I think
whole...
we should make an appeal to
Yes.
men that they should understand that vasectomy is not the only way, but it's an adjunct to contraception, because the issue of population explosion is real in our country.
And sir, many contraceptives makes us fat. I hear.
Pills
And
for
we
women.
don't pills make us turn us to something
I mean,
else. And we
there are
don't want to.
effects
So
of
I'd rather the
hormone
husband do something about the matter.
After 4 children, what are you waiting for, sir? Just 15 minutes, 2,000 naira, freeze your egg just in case you want to do it later
And
in
we're
life.
good to go.
And everybody's okay.
In fact, I'm making a call. Let's go on a break.
We're going home.
Thank you so much, Sir. It was a pleasure having you here.
High five.
That's all we
Thank you.
can take on the show. Join us tomorrow for our live audience show. Come early so you can get a seat. Have a fabulous day. See you then. Bye-bye.
Bye.